Welcome. Thank you for joining us on today's webinar hosted by the National Center for Pyramid Model Innovations. My name is Victor Trinidad with NCPMI. This webinar is part of the Within the Framework webinar series. Today's topic is for state leaders by state leaders, scaling and sustaining state funding through policy development, presented by Deborah Ziegler, NCPMI, Brittany Harrington and Alicia Westbrook, Lydia Bethay, Julie Betchkal, and Lana Nanide.
Good afternoon. As Victor said, I'm Deb Ziegler. It's very good to be here and have you all with us. We have a full afternoon prepared for you, and we're going to begin sharing some basic information about a policy process, and then we're going to dig into some state experiences and successes around developing and implementing policy by 5 of our experts in the state of Mississippi and Wisconsin. So we're really pleased to have them with us today to share their experiences and their reflections on the work that they've done in policy. So let's start out with this quote, one of my favorites by Benjamin Cardozo, a former US Supreme Court Justice. "The law never is, the law is always about to be." And I always say you can put policy in the place of law here. And we're going to talk about policy from a very broad perspective today, which includes laws and statutes. So our agenda for today is making sense of the policy processes. Mississippi will go first and share with us some of their policy and funding strategies. So today our policy work is centered on funding for the pyramid model. And then Wisconsin will jump in and share their successes in developing policy around funding. Oops, sorry about that. So let's look at the public policy working definition. The way policy reforms are planned, designed, implemented, and evaluated. And we're going to go into more depth on those 4 areas in a few minutes. So what's the reality of the policy process? All of you have probably been engaged at some level in your work on developing policies and implementing policies, but we know that this work is very, very complex. It looks like an amoeba sometimes. So here we have our amoeba, we have our external pressures, we have our interest groups inside, we have some interest groups outside, we have policy spaces, we have states, we have locals, we have all kinds of stakeholders. And then of course there on the left is the big bugaboo around time. Policy processes take a lot of time. They don't happen quickly for the most part, although I have seen some processes happen much too quickly and are probably not as well thought out. So time is really an important factor on this. So why are these policy processes complex and messy? Well, they involve different types of actors, and I use actors in a broad sense, stakeholders, whatever term you want to use, but actors seems to be a little bit more dramatic. And, you know, we're talking about complex and messy processes. So being a little dramatic here is okay, using the word actors. Actors from all walks of life and people who come from the field of early intervention and special education and mental health. And then our policy makers who may not have much background or experience in these areas. We know that the policy processes are influenced by lots of practice and experimentation. That's an important part of it. Events, and we all learn from our mistakes, and hopefully we make amends and move forward. And then also thinking about the actors' networks and who they're interacting with, collaborating with, advocating with, lobbying on behalf of. Policy processes are also shaped by discourses and narratives, and those are so important, and we need to give them their due time. And sometimes we spend too much time discussing and not enough time in actually developing and implementing. But you can't cut the process short of having those discourses and narratives, because in the end, my experience has shown that when you give that part of the process its time, you have a richer end outcome. And then, of course, number 4 is having a highly political character. Policy also involves a lot of politics. And we're going to talk about what our roles are in that political process and how we look at staying in our lane and addressing the issues that are most pertinent to us. So here's a little cartoon for us, how a bill becomes a law. Again, we can substitute bill for policy. So we have a swing in a tree, initially with 2 ropes and 2 wooden seats in a back. So as introduced, as amended in committee, changed, as amended on second reading, different swing, huh? As enacted, totally different. As funded by the Joint Budget Committee, we know that well, sometimes it's empty. Let's hope that doesn't happen with our processes. As implemented by the state agency. Sorry, state agency guys, I know there's some of you out there in the audience. As reported by the media, totally different, and understood by the public. And then finally, what was actually needed. The swing now is a tire with a rope hanging from the tree. So we're going to delve into a couple of these areas and unpack them a little bit as we move forward. So the public policy engagement goes through several steps. So we're going to look at the definition of public policy, the phases of public policy life cycle, how we engage in public policy, and the types of public policy. So a definition of public policy. This is a Webster's definition, a decision of action of government that addresses problems and issues. You'll see lots of definitions of public policy. This is a simple one, and most of us are all about some kind of action related to government entities. So we're going to go with that definition for this presentation. So these are the phases of the public policy life cycle. We have problem definition, agenda setting, policy adoption, implementation, and evaluation. And this life cycle is a framework and is only a framework. It doesn't always develop according to this linear model. I like to think of it more as a cyclical model. It is incremental, and it always builds on prior developments and activities, and is extremely important as we move in our work with pyramid model for scaling and sustainability. So we're going to go through each one of these quickly and talk about what's entailed in the problem definition. So we want to make sure we have an identification of the problems and the challenges and solutions, and we do that through research and analysis. We want to look at what the policy changes might be. Are they statutory? Are they regulatory? Are they being led by the SEA or the lead agency? Are they at the administrative level? These are important distinctions in the problem definition. As we move to agenda setting, we want to raise the profile of the problem among the public and the decision makers. So you saw that cartoon before where the public had no idea what was going on, right? And the decision makers may have a whole different opinion of this. And then what's the agency culture regarding policy? It's important to know internally your agency culture, and then externally other cultures of other agencies that you may be collaborating with or having interagency agreements with. We want to make sure that there's support from internal and external stakeholders, and that we always look at a very detailed side-by-side analysis of the possible revisions and what some of the intended and unintended consequences may be. We move on to policy adoption, where we prepare our strategies, we convene stakeholders, we consider the trend data, and we want to make sure that we consider the input from consumers and developing and articulating and messaging a very strong rationale. Now, as we move to implementation, we want to look at positive outcomes and unintended consequences, and those will help us ultimately determine the policy's effectiveness. And then where do we need to go from there? We said it's a cyclical process. So the next step then is to evaluate your implementation. Unfortunately, evaluation phase has been ignored in many processes that states and entities have set up. And we need to think about building an evaluation from the very beginning and integrating it into all of the phases. We know that it's important for us to look at policy research and analysis and using those strategies to evaluate whether the policy meets the original intents. did you go down the road that you hoped to go down? And if not, why not? And if you need to change it, what do you need to change about it? So if the policy isn't successful, then you need to move back in that cyclical process, right back to problem definition and start all over again. So as I said, it's not linear, and we know that we enter and exit at different points in time. So how do we engage in public policy? How should we determine what strategies we might use? Well, you want to know what phase of the policy life cycle you're entering. So is it the problem definition, or groups already in agenda setting? Are they adopting policy? That's an important piece of information to know, where you're going to enter and then how you'll interact based on that entrance into the life cycle. And then we know that different strategies are more effective at different stages of the policy formation process. You want to gauge what your political climate is. Has there been any changes in executive or legislative leadership? Have there been any elections? Has the political climate changed? And we know right now we are still in kind of, from a national perspective, we're still in a transition from a new election. And I know many of your state governments are also in transition based on last election. So we see new dynamics happening, new players, new actors, et cetera. And of course, you always want to know what jurisdiction your policy is coming from, whether it's local, state, or national. And in this case, whoever the funder may be and what impact you want to see happen. So these are a couple of strategies that individuals and groups and teams and governments use to engage in public policy. And each of our presenters and states are going to really share with you how they used some of these strategies in the work that they did with policy development. So we know that there's the building of coalitions, sharing of resources and knowledge and skills, community organizing, raising the profile of the issue. Funding demonstration projects is an effective strategy. It demonstrates new innovations and gives the likelihood of a policy being adopted a little bit more emphasis. We have issue advocacy, and that's divided into lobbying and non-lobbying. We know that lobbying is influencing a particular policy, and probably you in state governments, state and local governments, are not going to be on the lobbying side of this, but some of you may be in private entities who could have that. You need to determine what your rules are within your agency and stay in your lane, and that's important. Most of us will probably be more engaged in non-lobbying efforts, and those are nonpartisan research and technical assistance, helping inform policy members about the intended policy that you want to change and adopt. On the second column, you have litigation, media, and communications. You know by our cartoon that it's important to include the communications and media in your journey. It's important that it's whatever the policy changes are articulated clearly and understood by internal and external partners, as well as the community in general. We talked about policy research and analysis. Public education is important. Framing and messaging what the new policy will be. Looking at our public and private partnerships and leveraging those resources. Many of you will be involved in some kind of regulatory advocacy at the state level to see that we have fair and proper implementation of a statute, either a state statute or a federal statute. And then voter engagement, or get out the vote. So we're going to now turn to our types of public policy that you might be involved in. This is a pretty complex chart. I know it's small, but across the top you have the type, the scope, the applicability, the duration, the process characteristics, and the primary policymakers. And down your left-hand side, we're looking at possible types of statutory, fiscal, regulatory, or institutional. Let's just focus right now on this second set of blocks going across to the right, fiscal. So this would be, we're going to hear some information from our states around their annual budgets, around acts and resolutions. We know that the scope is a policy implementation scope, and the resources that are for priority policies within a state. We know that the duration for most budgets is a fiscal period of a year or whenever the legislative year may go. In some states, it may be longer than a year, but generally approximately about a year. They are always subject to revision or repeal by a plenary body, and we're going to hear some of that from our presenters. Lots of process characteristics, including public deliberation and notice. So there might be time for input and review and comment. And then the primary policymakers in the fiscal arena are legislative, executive, approval, perhaps university trustees, lead agencies, school boards, etc. So now we're going to turn to our states and have them really put some meat on the bones and take some of these broad-based policy processes that I've shared with you and really give it a life of its own to see how they work through some of these important strategies in their public policy work. So I'm going to turn it over first to our team from Mississippi.
Hi, everyone. We're super excited to be here today and to just share a little bit of information about how Mississippi is supporting pyramid model and specifically what some of our funding looks like and what some of our policy looks like. So what you see here is our pyramid model timeline. And if you'll notice, pyramid model is quite newer to our state, especially when you hear Wisconsin. And when they talk, you'll see that, we've had pyramid model in Mississippi for fewer years than many other states. But I think it's good to kind of see where we are and then where Wisconsin is and where other states are so that you can, as your state is, deciding what to do with pyramid model implementation, you can see where you might fit in and some ideas that might work best for you in your current implementation. So in 2013, Mississippi had its first ever state funded pre-K. So before that, pre-K was funded locally and, sometimes with federal dollars for Head Start, but we didn't have any state funded pre-K until 2013. And I'm going to show you a little bit of language from the bill on the next slide in a minute about what some of that said and some of the policy that we have on that. In 2017, we began pyramid model. So we've only been doing pyramid model here in Mississippi for about 5 years-ish or so. And we started with state funded pre-K. So that pre-K that we talked about in the bill and with some school districts. And you'll see that I have in the little circles there, some acronyms that probably don't mean a whole lot to all of you, but that means that's kind of who was supporting the work. So our state personnel development grant, which is where I work and who I work for, was the sole supporter for the work at that time. And all the funds supporting pyramid model were coming from that state personnel development grant. And then 3 years later in 2020, because of the great collaboration that I have with my friends here on the call with me, we were able to start extending the pyramid model to childcare. And that happened in 2020. And at that time, Alicia's group, and she'll talk in a little bit, the Mississippi Early Childhood Inclusion Center came on. And in 2021, we had K-12 social emotional learning standards published. And I wanted to tell you that because right now in Mississippi, we have a big social emotional push. So it's a great time for us to do more with our outreach, to do more with our stakeholders, and to do more with our policy building because social emotional development is a big passion for our state right now. And it was in 2021, which was last year, that our Department of Ed came on. So just to let you see, if you're not from a Department of Ed, it doesn't have to start there. And so you can go to the next slide. I'm Deb. And here's a little bit of language from our pre-K bill. And the language highlighted in the red just tells you how groups were able to be awarded state funds, and that was through a collaborative approach. And if you're not familiar with that, you're definitely welcome to email me. I can put my email in the chat. But anyway, there's There's a little bit of information there about the collaborative approach. And then you'll see in the green highlighting is where it talks about what types of learning has to be included in or included for the state funded pre-K. And you'll see that social emotional development is included. And that is really all the policy that we have as far as the state funded pre-K goes on using social emotional development. At this point, we don't actually have pyramid model in any language, but we're hoping to go there in the future. Deb, if you can go to the next slide. And so here's what I would like for you to hear about from Mississippi and what's worked for us and what's made us be able to scale up our implementation and then also to sustain what we have. So our relationships have been super important. We have an SLT that's pretty strong, and whenever we were developing the SLT, we strategically brought members on. So we brought members on that we know would work well, that worked well with us, and that we know had a passion for development overall, and that social emotional development was important for them. Also with relationships, I found that if I wanted something, I should just ask for it. Like, sometimes I'm like, oh, I don't want to ask for money. How do I ask people for that? But if I just said, hey, can you do this? Hey, what about this? I even asked Lydia something one time and she's like, oh yeah, sure, we could look at including that. So if you want something, ask for it. And then as far as line item funds go, I know that's super important, but if you can't do that, start small. Look at what you're doing, whatever you're doing now, or whatever programs are doing now, how can you align with that? So for example, some of the programs I work with, CLASS is really big in our state, the assessment tool, the quality evaluation tool CLASS. And that is big, and that's not something that my office does, but there's lots of alignment. There's an alignment document out there that Head Start published between CLASS and TPOT. And so what I do is I take that and I show folks, okay, look, if you implement pyramid model, it's going to help you meet indicators that you need on CLASS. And that's just one example. And so we try to do that as much as we can. That's how I was able to get some Department of Ed coaches on board. I said, hey, you're already out in these places and you're already talking about social emotional development. So can't you just throw in some pyramid model for me? And now we're co-coaching, if that's a word. So always look and see where you can align with what's already going on in your state. We are excited that we just planned like an hour ago the date or some possible dates for our end of the year celebration. We're looking towards getting an annual report written just because we want to make public awareness available for what's happening in our state. We've never done a celebration. We haven't completed a report yet, but we're super excited to add those things in so that we can make more people, more legislators, more directors, more people in different agencies aware of pyramid model and what it's doing in the state. And we're adding some new implementation sites, both in childcare and in public pre-K. And whenever we do that, we want to make it, we're trying to move past certain geographical areas and to move into other areas we haven't been in before, just so that we can make that public awareness strong. And so now I'm gonna let my childcare friends take it over and tell you really about how we're able to fund the childcare portion of our pyramid model.
I apologize. My computer doesn't like me again today. Again, I am Lydia Bethay. I am with the Mississippi Department of Human Services. I'm with the Division of Early Child Care and Development. And my division is the office, the agency that receives the CCDF funding, and we are tasked with using those funds to, of course, as you know, to improve and move forward with quality programs and services in the state. And so as Brittany has already mentioned, she's told you a lot about who is doing pyramid model. And with 2 agencies in the state of Mississippi, we have an opportunity, a great opportunity, and the finances to move forward with more outreach and reaching out to those centers. And that was how we got involved with moving toward our childcare centers, our private childcare. And so Brittany talked about the state personnel development grant. and how she is operating under that. But she did reach out to me a year or so ago, and she wanted to ask if I would serve on the SLT, the state leadership team in our state. And I jumped at the chance because I've had a little bit of background with pyramid model, and I knew the effects and how important it was, especially in this time that we all find ourselves in. And so in that, I decided that I would start out kind of like a pilot program, and I dedicated 3 of my staff that are going to be using and implementing the pyramid model. And because of our wonderful relationships with collaborative work across our state, Brittany and Alicia and I have been doing work together at different agencies, different times over the past few years together. And so it was an easy fit. So one of our sub-grants with DECCD is with MECIC, the Mississippi Early Childhood Inclusion Center, and well, they are housed at the University of Southern Mississippi. And so it was easy because I came on later in the game than MECIC did, as far as being on the SLT and trying to implement pyramid model. But Alicia's group was already working in that arena, and her staff were already going forward with this implementation. And so because of the good relationship, working relationship, collaborative efforts that our entities have experienced over the years, it was really easy for us to just blend right in. And so I dedicated 3 staff members as a start. And through that collaboration, altogether, we have been getting technical support through NCMPI. And we've gone through Tippy Toes training. We have a future training coming up on the teapot together, all of the coaches together. And the goal is that we will be able to reach out to more implementation sites to implement pyramid model. We also have been working with coaching staff. And so I have taken advantage of the wonderful friends I have that are already doing this work, and I am using them to be models and mentors to my staff. After working under the SLT and seeing how powerful this was going to be, I have reached out to my upper management, and we are now in the process of looking for other states who are using their CCDF and other federal funding, like the American Rescue Act funds. We are looking ways they have used that to implement pyramid model. And so my goal over this into this next funding year is that we will be able to dedicate more money toward this pyramid model. And in that process, that will mean that eventually all of our staff will be trained and able to use it in the work that they're doing with their child care centers. We also, under my purview at DECCD, we also have the Resource and Referral Network, the child care resource and referral sites. Most of them are currently on community college campuses and or university campuses. We have 2 universities that have come on board. One is with University of Southern Mississippi. See what collaborative work can do for states. So they have opened up 2 new resource and referrals just recently. We also are now in the process of opening a resource and referral site with the University of Mississippi in Oxford at Ole Miss. And that resource and referral service is very important because it is a network. Most of them are as alike as possible as they can possibly be under whatever funding that they have locally or wherever they are housed. It's a partnership with the community colleges. And so, but they are required to have certain things. And one of those is, right now, they all have, with the help of MECIC, They all have materials that promote social and emotional learning, as well as materials that support those children and families and teachers that work with those children and families with special needs. And so a whole section in their centers are dedicated toward that. Plus, they are able to push out information to families and to child care centers on social and emotional help, and they navigate those processes to get those families and the teachers the help that they need through this. So the goal is that we will have more staff that will be involved in pyramid model, the implementation of it in private childcare as we move forward. But the definite goal is that every R&R site will have somebody dedicated to pyramid work that will be that go-to person to make sure that all centers in that region are able to access this. Now that is our direct funding, but our indirect funding comes in with the Mississippi Department of Ed. Their pre-K coaches, like Brittany said, they are implementing pyramid model. And so we are able to access their expertise as well. But that is, they do not receive funding from, they don't receive federal funding, but they do have that state funded pre-K. And so basically what we're doing, we're feeding off of each other at each agency, and we are able to make it a cohesive group. And it's also ensuring the continuity of the services and also how we are implementing it so that we can all work together. And every child, whether they're in a state-funded pre-K or if they are in private childcare, then they are able to have that access and to get those skills early on. And they're not going to be any different as they move from childcare, pre-K, into those school districts as kindergarten. And the next slide, you will see our position statement on social, and this is coming from my office, DECCD, on social, emotional, and behavioral health, and the use of suspension and expulsion. And I'm not going to read it to you, but I wanted this slide in there because it's very important for you to understand that DECCD is dedicated to this. We recognize the importance of this social and emotional development in young children, and that we are definitely on board with this and are using federal funding as we explore other states that are using federal funding. We're trying to decide how it's going to work in Mississippi. And right now I'm going to turn it over to Alicia.
Thanks, Lydia. I'm Alicia Westbrook, and I direct the Mississippi Early Childhood Inclusion Center. And really this position statement, it's in our state plan, and it is how we're able to implement the pyramid model. Like Brittany and Lydia have stated, we really are at a place right now where we are sharing resources, and that allows us to also share the same message. And so with our work on the SLT and our relationships with MDHS and DECCD, we were able to help meet our state plan through implementing the pyramid model. So we are starting with our first child care implementation site this year, with future plans of expanding. Next grant year, we will open up applications for more child care implementation. But we're also able to bring training and technical assistance that's grounded in the pyramid model to our child care, which again, like Lydia said, it's greatly needed right now in our times. But the support that we have from our funders and our partners at MDHS, it allows us to implement the teapot, the tippy toes. It allows us to provide social and emotional credentials that offer stipends to child care providers so that they are willing and wanting to know more and wanting to become implementation sites. So I won't keep you too long, but I just want to say that it is important to have collaborative relationships. And now we have 2 state departments that are allowing all of us to do this work. It's allowed Mississippi to develop and expand our professional workforce. Just a few years ago, Brittany was pyramid model. She was the only one who had gone through the trainings and who was doing this work in our state. And so, again, with the state departments and their support, we now have REACH implementing pyramid model in public pre-K. We have additional Department of Ed coaches helping to implement pyramid model between MECIC and MDHS staff. We have coaches and trainers for childcare this year that is happening. So it's really exciting to be able to say that through relationships, through our policy, we have increased our workforce and we've increased the people who are getting this out there, which also now includes at least 13 reliable tippy toes trainers, which I'm really excited about, so that we can take this even a step further with our infant and toddler programs. So thank you.
Well, thank you, Mississippi. Wow, lots of accomplishments. So let's now move on to our friends from Wisconsin.
Thank you very much, Deb. And if you can animate the next slides. It's a delight to be here with you all this afternoon, and always just so interesting and rejuvenating to hear from other states as well. You can go back, Deb, to the last slide. So I want to talk a little bit. I'm Julie Betchkel. I work for the Wisconsin Alliance for Infant Mental Health. We are a nonprofit organization that holds a contract with our Department of Children and Families to coordinate Wisconsin's pyramid model work. And I'm here with my colleague, Lana Nanide, who will talk a little bit later. And we picked out what we feel are some of the key pieces that have lent to sustained funding for our pyramid model work in Wisconsin. The first is, in our very beginning, we had just been accepted as a CEFL implementation state. Pyramid model became embedded into our quality rating improvement system called Youngstar. Over the years, our Youngstar has just been revamped and to include high quality practices for formal ratings that include attendance at approved social and emotional or inclusion training. That training, Wisconsin also has a collaborative pre-K model, and that training can be accessed by trainers that our pyramid model team supports in R&Rs. We have CSAs, those are our agencies that provide training and technical assistance to school districts, our Wisconsin Early Childhood Association, our Head Start training and technical assistance. So from the beginning, we've all shared in a cross-sector way our pyramid model training in Wisconsin. The next step in our Youngstar work is to consider how we can provide some acknowledgement for deeper programmatic efforts to support social and emotional competence and use of classroom practices. So to acknowledge program-wide implementation as an above and beyond Youngstar rating. Next slide. as part of our work, and this ties to what Deb said about encouraging discourses and narratives. We've worked to build the capacity within Wisconsin's licensing and PDG regions to also have a pyramid model lead in each of those regions. Those pyramid model leads connect people, they align ideas, they create opportunities, a lot like what Brittany was saying. Oh, you're doing this, pyramid model can help with that as well. So making those connections. The pyramid model leads convene communities of practice for individuals that are responsible within their region for supporting infant and early childhood mental health, including pyramid model. They help support our program-wide sites through pyramid model institutes. We pull together internal coaches, or what we call our practitioner level coaches, and our program coaches as well, as a way to have folks who can learn together and understand the parts and pieces of pyramid model implementation. Next slide. Part of that work of pulling folks together who are doing broad level work within regions and communities is to help build our capacity for the direction we feel our pyramid model should move into in supporting community-wide implementation of the pyramid model framework. We continue to bring on, and our policy, our pyramid model policy is to bring on pyramid model sites through a robust readiness process, an application process where programs are provided with an external coach that we fund to build pyramid model implementation within their programs. And in that way, we've kept TPOD and Tippy Toes practice-based coaching through the pyramid lens and our team launch. We're close to the vest. So practitioner level training can be accessed by many people, and we hold program-wide implementation to our heart. And as a result, we have built partnerships with 3 communities that are working within their communities to support all programs that provide care and education to young children and going program-wide. So we're looking to replicate and expand the work in these 3 communities. Next slide. We've had flows and ebbs in our funding, and in one of those ebbing years, we took a look at our leadership team structure and decided that we would have a core team of individuals. Deb used the words internal stakeholders, right? Core team members whose work is related very closely to the implementation of pyramid model practices. And that team meets quarterly. And then we built an advisory team, a much broader external stakeholders group, folks who are supporting initiatives, providing funding, and creating policies that are interrelated with pyramid model, so that we can all continue to embed, infuse, and connect for individuals who are caring for children and families. Next slide.
So for us, it's very important to be integrating social and emotional wellness and pyramid model practices within infant mental health framework. We believe that that's really, really optimal for development of children. And it's imperative, right? It's imperative to make sure that the work that we've been doing, that you're doing, is showcased and talked about at a variety of meetings, groups, committees. So not only we should have state leadership team groups, that's very essential, but we should also go to existing councils, committees, and groups to make sure we talk about this work, to make sure that we're very aware of what are the issues, what are the problems, and can we offer a solution to issues and problems. So we were invited to present at the Wisconsin Legislative Children's Caucus, and our port of entry was, how can we think about reducing expulsion and suspension? What are the strategies that lead to reduction in suspension and expulsion? So again, finding what is that door that you might be able to enter through, and making sure that you have solutions to problems. Next slide, please. We believe that it's really important to, again, be visible, and visibility leads to continued relationships, more questions, more visibility. And I definitely heard this from the story, the Mississippi story about relationships and connection, and just how important that is. And so the story of the blue car is the story of our Secretary of the Department of Children and Families then, under the previous governor, wanted to have 2 town halls in Milwaukee and Madison on pyramid model. And we were able to invite Mary Louise Hameter, one of the principal investigators, to speak in Milwaukee. And then to make it from Milwaukee to Madison, we used Julie's car. And on the back of the car, we had ML sit with our Secretary of the Department of Children and Families. And so that was an 1.5 hour drive where we talked about the pyramid and the children and making yogurt and building relationships. And that's right, what can happen on those journeys is quite marvelous. And this is also a reminder, I think, to me and to you, that it is about relationship. It's also about patience and time and perseverance and commitment. And so relationships led us to be able to do a study, which was so important to us. Getting data, showing the effectiveness of the framework is key. And while there are definitely national data, this is a very much research-grounded framework. For us, it was important to demonstrate effectiveness in Wisconsin. So in 2016, a study by University of Whitewater was released that was really pivotal for us. We really needed to show the data, local data from Wisconsin, and that became another door opener, right? We were able to present this data at the Early Childhood Advisory Council that advises to the governor. And really, truly, every meeting I went to, and I go to many, many, many meetings, I just had handouts. I think they were in my car trunk forever. And so that this is very important. It's important to be able to justify your story, to show the data, and to share narratives. So again, this was pivotal for us. And so next slide.
And I'll add, as Lana is gathering for the next slide, Wisconsin was a pilot state for the Pyramid Model Implementation Data System, PIDS, the new system, and we really believe that new system is going to help us continue to tell the narrative through our data.
Yeah. And very quickly, but I want to point out that the study we showed you quickly that was effective messaging tool for us was done in 2016, and in 2019, you see, we made it into the budget, which was a huge success. But I'm just again saying that it takes time, it takes relationships, it takes perseverance, and the good work. So this was really exciting for us. And as you can see in governor's budget, their actual words, Wisconsin pyramid model. And we are very thoughtful and careful about using the words Wisconsin pyramid model. We believe it promotes buy-in, it promotes sort of ownership. It's our thing, it's our pyramid model. So that's really important to us. As you can imagine, governors change, that happens too. And Deb was pointing out how important it is to understand and know the climate and how different dynamics lead to different outcomes. We're very fortunate that our current governor is very supportive of early childhood, and we have a good relationship with the Office of Children's Mental Health. Again, that's another connection. And we're very lucky that Wisconsin's First Lady chose social and emotional health as one of her key efforts. So because of all of these relationships, we were able to organize and arrange site visits to our demonstration implementation sites. And the pictures you're seeing on the bottom of the screen is Mrs. Evers, Wisconsin's First Lady, on a site visit in 2 different sites in Wisconsin. Again, that is a beautiful opportunity to showcase the work, to lift up what we are doing, and to have some publicity for state leadership. So that was really beautiful and exciting. Next slide, please. We are a nonprofit agency. We're a statewide nonprofit, so we are able to advocate and educate state policymakers and legislative representatives. And so really, we are trying to connect to the idea that we need to support babies and toddlers. We are not afraid to use the word babies and infants. In fact, we really believe that this is really important because funding usually misses our babies. And so we want to make sure that we are the voice for the babies, that we can speak for the babies. And so we were trying to advocate and promote the idea of encouraging community members of our agency to ask for certain allocation and attention in the governor's budget. And next slide, please. It was really exciting for us, that it was hopeful for us that in the governor's proposal, the governor included $3.2 million to support social and emotional learning. And it was a celebration for us. It was wonderful and exciting. This budget did not pass our state legislature. And so again, it's a relationship, it's a dance, it's a, steps forward and step backwards. This particular budget didn't pass. And so, but on the other hand, what we are celebrating and acknowledging is that we made it this far, right? We were in the budget. There was possibility of expansion. It was an acknowledgement. That means that we're moving in the right direction, even when we step back a little bit. So speaking of moving backwards and forwards, if we get to the next slide, and I realize that we're running out of time, but I will still mention that so there was a proposal that did not get funded of supporting social and emotional learning. And additionally, there was another push, another ask, another attempt from our State Department to use discretionary CCDBG funds for pyramid expansion. And that also didn't get passed. And we already mourned that and grieved that, and it's okay. We are okay. We are okay because we are celebrating the tremendous support we have both from the State Department of Children and Families and incredible support and commitment from our programs, from families, from administrators who called and wrote letters and wrote emails. It was the most touching, the most uplifting, a slightly frustrating period. And it's okay. It's okay because we still have, and if we could get back to the next slide, because we still have our infrastructure. These pieces of infrastructure remain. We didn't get the supplemental expansion funds, which we were excited about. We had plans, we dreamt, but temporarily we don't have access to that. And it is okay, because again, we have lots to celebrate, great support, an incredible team, and a lot of hope. So I think that's our Wisconsin story.
Wonderful, thank you. So, wow, lots of good thoughts, lots of good strategies, amazing professionals, lots of impactful work going on in Mississippi and Wisconsin. So thank you so much for sharing. So as we kind of recap here, what I tried to do was look at those strategies of how to engage in a public policy that I presented before. And as I went through the PowerPoint presentation, these were the strategies that each of the teams brought to the table. And you can see there are many of those strategies in their work for developing policy as well as looking at funding structures. And I have to say, I want to add a few to my list. So Brittany, I loved it. If you want something, ask for it. What a wonderful strategy. Very simple, right? But it's impactful. So I'm going to add that to my list of policy. And I loved you sharing the position statement about restraint and seclusion, or I'm sorry, expulsion and suspension. And, you know, that goes back to our types of public policy. It's an important institutional policy that help you move forward many, many initiatives. And in Wisconsin, Lana, I love the picture of the public meeting that you testified, just your passionate look on your face as always. And it looked like in the corner that was a newscast, so involving the media and the press. And then the blue car story, wonderful. And I'm going to put this in my policy list too, is it's a good example of seizing the moment, right? Having ML and the secretary in the blue car. And then of course, elevating the messaging and the status of the message by the First Lady's story and having her visit. Brittany, back to your celebration too. I was thinking, I hope you're going to invite the media to your celebration. So wonderful strategies, great implementation. So as you move forward in your work, and this is directed to you as participants, some questions you might want to ask in the public policy life cycle, going back to those 5 phases of the public policy life cycle. So how's the problem framed? Looking at impacts, social norms, benefits, and community support. We want to look at agenda setting, the solutions available. Are they acceptable, feasible? Do they get to the effect that you want? Equitable? What are the political costs? What's the advocacy that's going to be necessary? Looking at policy adoption. What's the direction of the decision makers, the political climate, the scientific evidence that you have? Where's the administration on these? And then what are the financial factors? As you move to implementation, ask yourself some questions about adoptive policy, and is it achievable within organizations? Who were the actors, the resources, and the expertise that you're going to need to implement? And then finally, moving to evaluation. What are the discrepancies between those expected and actual outcomes? So was the problem reduced? Was it relevant? Did it improve? Do you need to modify it or phase it out and start all over again? Lana said we go 2 steps forward, 2 steps back, but then we make 6 steps forward. So this is all part of this very complex and messy process, but hats off to all of you. You're doing a great job on it. So let's try and for the next couple of minutes and open it up to some Q&A. I don't know if I can't see the chat room. So if somebody or the Q&A are there any questions in the box?
So I can see questions. There's a question for Mississippi. What staffing levels were necessary for implementation within the Department of Ed and university?
So I don't know if that means the number of staff. That's what I'm assuming that means. So whoever asked that can correct me if I'm wrong. But I think it just depends on where you are in your implementation and where you're going. Like for instance, when we started, it was 1 person, me, at the university, and now it's grown to 2 people at the Department of Ed plus me. And then Alicia's at the same university, but she does a different sector, and she has 2 people that do that. It's not all of their job, but most of their job. And now Lydia said she dedicated 3 folks. So when we started, we literally started with 1 person, and now we've grown upwards to, we're hitting close to 10. So I don't think there's like a certain number that you necessarily have to start with. It's where you are in your implementation and what you need. And definitely Deb and maybe Barbara and Alyssa could talk to that from a programmatic standpoint from NCPMI if they want to.
Julie, are you seeing? Go ahead.
And I was just going to add to that with our work that we're also doing with NCPMI through our TA, although we only have a couple of people that are working on our implementation site, our whole preschool team, so there's about 7 of us, are getting the training and building up that workforce so that you can expand and go out. And I think too, I think a lot of people have talked about how things are related. And so, how does it fit in with your current work that you're doing? And I think that helps to expand your capability.
Julie, other questions you see there?
Yeah, there's another question I think the most important pieces of policy are having an intentional plan for the work. Can state leaders talk about how they created a plan for making pyramid model implementation happen? And since I'm unmuted, I can talk about how Wisconsin does it. So from the very beginning, we've been using the state benchmarks of quality. We meet as a leadership team every October and do the rating and use the results from that data to help us make decisions about what critical elements of infrastructure we're missing. I think we've addressed all questions.
Having said that, let's wind down here, and thanking all of you for being with us today, and thank our presenters for the great examples and sharing with us the impactful work that they're doing. And I'm going to turn it over to Victor now.
All right, thank you so very much to our panelists for your wonderful insights. Your feedback is very important to the work that we do. Please remember to provide your feedback on this webinar with our post-webinar survey by typing the web address shown on this slide into your internet browser. Your certificate of attendance will appear once you submit the survey. We invite you to visit our website, challengingbehavior.org, to sign up for our upcoming webinars, access recordings, download pyramid model resources, and more. Thank you to our funder for making this webinar possible. This concludes our webinar. Thank you all and have a great rest of your day.